If you're watching this video, it's probably because you have a cataract that may need surgery. I'm Dr. ElMallah. I want you to listen carefully to this video and think and jot down any questions that come up so we can discuss them when we meet. So, you have a cataract. A cataract is a clouding of your natural lens. Your natural lens is a lens you're born with in each eye. As time passes, that lens starts to get cloudy and hazy, and as each year passes, it gets hazier and hazier, until eventually you notice that your vision isn't as good as what you remember. When you get to that point, we start talking about doing cataract surgery. What is that? Cataract surgery is removing the cloudy lens, the cataract, from inside your eye and replacing it with a new clear lens. It is actually the most commonly performed operation. More people have cataract surgery than any other surgery. It's something that we all eventually get if we live long enough. The procedure itself is usually fairly short, taking usually less than 15 minutes. The chance of a complication with cataract surgery is low. Possible risks are infection, the need for more surgery if we can't take out the whole cataract, and then the possibility of having a problem with the retina or getting a retinal detachment. In general, the chance of any of these complications combined is less than 2%. We typically do surgery on one eye, on your first eye. We see you back the next day, a week later, and if your other eye also has a cataract, then we do cataract surgery on the other eye then. Many people also view cataract surgery as an opportunity not only to see better, but also to decrease their need for glasses or contact lenses. If, after I examine you, we deem that your eye is healthy enough, I may discuss with you different lens options. One option is to have a multifocal lens placed. A multifocal lens is a lens that lets you see both distance and near with less dependence on glasses. That's because that lens has a clear point or a focal point for distance as well as for up close. So that's really nice. You can get to see distance and up close without having to wear glasses. Now, no lens is perfect, and so with that lens, you can't hold something really close to your face and still expect to see it, and you may not be able to read really fine print or the back of a medicine bottle, for example. You may still need to wear readers for something like that. But having that second focal point up close can significantly decrease how often you have to reach for glasses. The drawback of getting a multifocal lens is when you're out at night, you will see rings around lights at night. That is very common and is an artifact of how that lens splits the light over distance and near. It's not something that should stop you from driving at night or doing the things that you normally do, but it is a different way of seeing the world at night. If you have astigmatism, I may also discuss with you a toric lens or a lens to correct astigmatism. If you have your astigmatism corrected inside the eye with a toric lens or an astigmatism correcting lens, that means that when you're not wearing your glasses, your vision is going to be clearer because a lot of that refractive error, that focusing error has already been corrected inside your eye. So all of these are options that we may discuss when it comes time to talk about your cataract surgery. These upgraded lenses to try and decrease your need for glasses are not covered by insurance, and today we'll give you a brochure which explains those different lens options as well as the pricing for those lenses. You may of course have the standard lens that's covered by insurance, and with that lens you'll see better than what you're seeing now, but you'll still have to wear glasses afterwards to get the best possible vision. So, I know we've covered a lot in this short video about cataract surgery. We've talked about the benefits of cataract surgery. We've talked about the risks of cataract surgery. We've talked about some of the different lens options. I hope you have some questions for me when we meet. I look forward to speaking with you. Thank you very much for your attention.